Welcome to the She Found Motherhood podcast. Dr. Sarah and I, Dr. Alicia, are talking about anemia in pregnancy today. It is so common. About 1 in 5 pregnant people actually have iron deficiency anemia. We talk about what that means, how do we diagnose this, and most importantly, how do we treat it. Now, we are so privileged to have this podcast sponsored by Kidstar Nutrients. They have an amazing iron supplement that we'll talk about a little bit more later in the show. So we can't wait to get to it. We'll talk about it right after this. Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated.
There can be a bit of confusion around anemia in pregnancy. How much is normal and what needs to be treated? We thought we'd lay out the basics so you can understand what is happening with your body.
So, what is anemia? Simply put, anemia is a reduction in the hemoglobin or red blood cells that causes a decreased ability of your blood to carry oxygen to your cells.
You might ask, is anemia normal in pregnancy? Well, yes, during pregnancy, a degree of anemia is actually normal. The total volume of your blood increases by up to 50% in pregnancy, and although your red blood cells increase as well, they don't increase as much, so this leads to a lower hemoglobin level.
In fact, it's so normal and expected that the definition of anemia by laboratory values is different in pregnant people when compared to non-pregnant people. In a non-pregnant woman, we would define anemia as a hemoglobin of less than 120 grams per liter, or in the US, less than 12 grams per deciliter. However, in pregnancy, we do expect a certain degree of anemia. So the guidelines for anemia in pregnancy that have been defined by the World Health Organization and the American College of Gynecology are as follows. In first trimester, less than 110 grams per liter or 11 grams per deciliter is considered abnormal. In second trimester, less than 105 or 10.5. In third trimester, less than about 105 to 110 or 10.5 to 11 is considered abnormal. And in postpartum, less than 100 grams per liter or 10 grams per deciliter is considered anemia.
Now, it's important to understand that some people may have a pretty big drop from their baseline hemoglobin without actually crossing these thresholds. So if your levels fall within the pregnancy normal, but you're feeling quite fatigued, then it's definitely worth pursuing further.
How common is anemia? Well, we know about all reproductive age women, pregnant and not, about 30% are anemic at baseline. We also know that during pregnancy, this number is even higher, and the World Health Organization estimates that about 40% of pregnant people are anemic globally.
So how do we know what anemia needs treatment and what anemia doesn't? Well, to start, we need to figure out the cause of the anemia. Is it physiologic anemia of pregnancy, meaning the expected normal dilution of your blood? Or is it iron deficiency, low vitamin B12, or something more rare like thalassemia?
Physiologic or dilutional anemia is a result of the underlying physiologic changes that happen during pregnancy. Your blood volume increases by 10 to 15% in the first 6 to 12 weeks of pregnancy, and then it expands rapidly until about 34 weeks of pregnancy. The total increase in volume at the end of pregnancy is about 30 to 50% over what you would normally have.
A nice analogy to make to really understand this concept is like an analogy of making a powder drink. For example, Gatorade, for those sports fans out there. You know, if you're supposed to add a cup of water to the amount of powder you add, the more water you add, the more dilute the drink will become. And it's the same thing with your blood. Your volume increases and the red blood cells don't increase as much.
Now, your red blood cell mass does actually increase in pregnancy as well, but not to the same degree as your blood volume. So it only increases to about 15 to 30%, hence the term physiologic dilutional anemia.
So how do we differentiate between physiologic anemia of pregnancy and other common causes? Well, the severity of the anemia is one indication. So physiologic anemia is typically mild with hemoglobins in the range of 100 to 110 grams per liter. But in addition to testing your hemoglobin, we look at other nutrients that impact your hemoglobin and red blood cell stores, and these include iron and vitamin B12.
Iron deficiency is one of the most common causes of anemia in pregnancy, occurring in about 18% of pregnancies. So that's 1 in 5 almost, and more commonly presents in the third trimester when iron requirements are the highest. It's the second most common cause of anemia in pregnancy after physiologic anemia. In addition to iron deficiency and anemia, many pregnant people have iron deficiency without anemia. So that means that your iron stores are low, but your hemoglobin hasn't started dropping yet. But you've been using up all those iron stores to keep up with your hemoglobin creation.
So, iron deficiency is actually very common in reproductive age women, even if they're not pregnant. And this is thought to be a result of low dietary iron intake and blood loss during menstruation, or even blood loss from previous pregnancies that hasn't yet been replenished. It can also be impacted by anyone who experienced moderate to severe nausea and vomiting in early pregnancy, as this can limit the amount of iron that you're able to absorb during pregnancy.
And so anybody who's menstruating actually probably should be checking their iron levels to see if they need to be taking a supplement. Our new favorite is Kidstar BioFe, and we'll talk about it a little bit later in the show.
So when we're looking at iron deficiency, we check ferritin levels. Iron deficiency is characterized by a low ferritin level. We'll talk a bit more about this later. We check this level on your intake labs and at around 25 to 28 weeks of gestation. It's important to recheck your iron midway through your pregnancy, as iron requirements increase dramatically through pregnancy due to your expanding blood volume, as well as the iron requirements for your growing fetus's red blood cell production and the growth of your fetus and its placenta.
It is a good thing they come out so cute because they are the ultimate parasite. They
sure
will suck
are.
everything they need out of you. So iron deficiency is treated with either oral iron or intravenous iron, depending on the tolerance to the oral iron and the severity of the anemia.
Another less common but important to know about cause of anemia is vitamin B12 deficiency. Low vitamin B12 can also be a common cause of anemia in pregnancy and is more commonly found in individuals with plant-based diets, as B12 is only found in animal products or certain fortified foods.
Similar to low iron, low B12 is treated with either oral or injectable B12, depending on the severity of the deficiency. It's pretty rare to be one of those people who don't absorb B12, so the vast majority of people should be able to get their B12 levels up with an oral pill or a sublingual, so under-the-tongue tablet.
Other causes besides low iron and low B12 and physiologic anemia can include hemoglobinopathies. So this includes thalassemia and sickle cell disease, which are actually abnormalities of the shape of the hemoglobin. And these are much more uncommon, so we won't discuss these on the podcast today.
So why do we care about anemia and iron deficiency in pregnancy? Well, there's been lots of research done around anemia and the impacts on the developing fetus. So several large studies have found correlation between maternal anemia and the risk of preterm birth, which is birth less than 37 weeks, low birth weight, which is a baby that weighs less than 2,500 grams or 5.5 pounds at delivery, and small for gestational age newborns.
We also know from animal studies that iron is important for normal brain development and neuron, so the nerve cells in your brain, development. There have also been some studies done looking at the association between iron deficiency and some neurodevelopmental learning disorders.
Lastly, anemia can have negative consequences for the pregnant person, and there is some evidence that maternal anemia is associated with severe outcomes, including maternal blood transfusions, sepsis, which is an infection in your blood, cesarean delivery, and the development of cardiovascular disease later on in life.
Like we said, anemia in pregnancy has a recognizable association with fetal outcome. We see an increased incidence of low birth weight babies if the mother's anemic in her third trimester alone. We also know there's an increased incidence of preterm deliveries if the mother's anemic in her second and third trimesters.
So supplementing iron earlier and maintaining an optimal hemoglobin, so 100 to 120 grams per liter or 10 to 12 grams per deciliter throughout gestation has better overall outcomes regarding premature deliveries and low birth weight babies.
So how do we screen for anemia and iron deficiency? Well, we do a CBC, which is a complete blood count that looks at your red blood cells and your hemoglobin, as well as ferritin, which is the protein that stores iron in the first trimester and again around 25 to 28 weeks of pregnancy.
So if we find out that you are anemic and have iron deficiency, how do we manage that? So in terms of prevention of iron deficiency, we recommend that pregnant people begin taking an iron-containing prenatal vitamin prior to pregnancy or upon diagnosis of pregnancy. This is particularly important for people with a history of anemia and or iron deficiency. And if you know you're anemic, thinking about trying to conceive, you should just start an iron supplement right away.
Now, for treatment, we typically begin with an oral supplement, and we recommend this be taken every other day, as we've actually learned it improves absorption and reduces some of the common side effects people experience with oral iron. Typically, around 60 milligrams of elemental iron is an adequate dose to start with.
We expect there to be an increase in the hemoglobin levels around 2 weeks after starting supplementation, as that's kind of the length of time it takes for your bone marrow to create new red blood cells. And for people with severe anemia, for those who cannot tolerate oral iron, or for those who are, despite taking adequate doses of oral iron, don't see an increase in their hemoglobin levels, there are intravenous iron options that we can order for you. Hey, Sarah.
Yes, Alicia.
Did you have to take iron supplements in your pregnancies?
I sure did, for all 3. Most pregnant people end up needing to, especially in the 3rd trimester. Why do you ask?
Well, I really struggled with nausea and constipation from the iron supplements I took in pregnancy, but I recently tried this new supplement from Kidstar Nutrients. It is microencapsulated, so it gets absorbed really well without causing the constipation and stomach upset. And it's in a liquid form, so super easy to take. No swallowing big fat pills.
But those liquids usually taste disgusting. And can't they cause your teeth to discolor?
Well, normally, yes, but not Kidstar BioFe. Because of the microencapsulation, it doesn't stain your teeth, and it actually tastes delicious. My kids took it as well, no problem.
What do you mean your kids took it? Mine refused to take anything but those chewy gummies.
I was surprised too, but it tasted so good they thought they were getting a treat, but there's no added sugar. It also comes in flavorless drops for babies and kids that you can mix into food or liquids they're already drinking, and a small chewable tablet for kids or adults if you prefer.
And do the same rules apply around taking it 2 hours away from dairy or calcium?
Well, yes and no. The formulation of Kidstar BioFe actually protects it from the normal absorption issues with dairy, but taking dairy will still decrease the amount of iron that you absorb from the rest of your food. The other thing is you have to keep the bottles refrigerated after opening, but that's no big deal. Another great thing is Kidstar is giving our listeners 15% off at kidstarnutrients.com with the code SFH15. And they have a refer a friend program giving both of you 20% off. Best deal ever.
Okay, well, for my plant-based family, I'll be heading there after we're done recording for the day. Thanks for the tip, Alicia.
So how do I know if my anemia is improving? Well, we expect to see a response in your red blood cell production to begin about 1 week after supplementation, and your hemoglobin levels should start to rise within 2 to 3 weeks following supplementation. Additionally, we should expect to see your ferritin levels increase by 3 weeks or so. So it's reasonable to check your hemoglobin and ferritin levels about 3 weeks after starting your replacement.
What about postpartum, you might ask? For most postpartum people, we generally recommend continuing your prenatal vitamin for a minimum of 6 to 8 weeks following delivery, and longer if you're breastfeeding. If you had a birth that was complicated by excessive blood loss, for example, a retained placenta, 3rd or 4th degree tearing, or an operative delivery, you might be at higher risk of having more significant anemia, and it may be worth checking your hemoglobin and ferritin levels. Unfortunately, there are no good clinical trials to guide postpartum anemia treatment, so it's mostly left up to expert opinion and clinical experience.
So how will I know if I'm anemic? Can I become anemic in the 3rd trimester even after the 25-week screen? Well, you sure can, and this is why it's so important to connect regularly with your prenatal care provider. If you're feeling fatigued, having difficulty with exercise, or even climbing stairs, or if your mood is low, these may be symptoms of anemia.
Whew. We covered a lot in today's podcast, and there was a lot of medical jargon. Alicia, do you mind summarizing?
Sure. So, anemia is a reduction in hemoglobin. There's a normal degree of anemia that happens in pregnancy, and this happens due to the amazing changes that our bodies undergo. The most common cause of anemia requiring treatment is iron deficiency. This is screened for in the first trimester and again at 25 to 28 weeks, or if you start to develop symptoms of iron deficiency, which include fatigue, low mood, increasing shortness of breath, etc. Treatment is typically with oral supplements such as Kidstar BioFe, and you should begin to see improvement within 2 to 3 weeks. Some women with severe iron deficiency, or those who cannot tolerate the oral supplementation, require intravenous iron.
Awesome. Thanks for the summary, Alicia.
No problem. And don't forget, we will link to the kidstarnutrients.com in our show notes, and we will put the SFH15 code that you can use for your discount right there. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.